Hello and welcome to the Project iCare podcast. This is a recording for healthcare providers who want to learn more about improving care for patients with substance use issues and addictions. I'm your host, Dr. Kasey Claborn, a clinical psychologist and research scientist at the University of Texas Dell Medical School.
And my name is Sydney. I will help narrate this podcast by defining terms, explaining concepts, and citing statistics that are relevant to the topic.
Ever had a patient ask you about the benefits of marijuana or wondered yourself about the difference between medical and recreational marijuana use? Well, that's exactly what we're talking about on today's episode, where you'll learn about the neurobiological effects of marijuana, eligibility for obtaining a medical marijuana card, and how marijuana use impacts people living with HIV specifically. Today, we are podcasting from Providence, Rhode Island with Dr. Elizabeth Aston. Dr. Aston is an assistant professor in the Department of Behavioral and Social Sciences at Brown University. She received her PhD in neuroscience from Wake Forest School of Medicine. Welcome, Dr. Aston.
Hi, Kasey. Thank you so much for having me.
So today we're talking about the use of marijuana both recreationally and medically and how it impacts your patients. So, Dr. Aston, tell me a little bit about how you became interested in researching marijuana.
Well, I previously researched heavy episodic alcohol drinking when I was in graduate school. But in 2012, I got really interested in studying marijuana because that's when the first two states legalized marijuana for recreational use, Washington and Colorado. So I shifted my research focus that year, and I've been studying marijuana since then.
Very interesting. Marijuana is a hot topic in the United States right now. Can you provide an introduction to this substance?
Sure. So marijuana actually refers to the dried flower, stem, and leaves from a plant called Cannabis sativa or Cannabis indica. And the plant actually contains the psychoactive chemical THC or tetrahydrocannabinol, which is what we typically hear about in the media and in a lot of research studies. That's the main psychoactive component of the plant, although there are hundreds of other compounds that are also called cannabinoids in the plant as well. And then in addition to the flower, extracts can also be made from the cannabis plants. So these oils or waxes typically are higher potency. They go by names like butter, shatter, wax, and high potency hash oil. So those may be considered cannabis or marijuana now as well.
According to the National Institute on Drug Abuse, the national usage rates of marijuana have significantly increased within the last decade. In 2013, NIDA estimated 19.8 million users of marijuana, whereas in 2017, there was 26 million users of recreational and medicinal marijuana. The national increase in usage rates has led to varying state regulations for medicinal and recreational marijuana regulations. Dr. Claborn and Aston will now explore the recent history of marijuana legalization in the United States.
So, can you talk a little bit about kind of where we are in the U.S. regarding legalization of marijuana?
Absolutely. So, since 1996, laws in the United States surrounding this topic have really been shifting. So, as of today, there are 9 states plus the District of Columbia that permit recreational use of marijuana. And now this varies by state with respect to how much you're allowed to have and things like that. And then there are also 31 states that permit medical use of marijuana. And if possible, this is even more variable.
Let's transition a little bit and tell me about how marijuana affects your brain.
So when an individual smokes marijuana or vaporizes marijuana, that main active chemical, the THC or tetrahydrocannabinol, that will quickly pass from the lungs into the bloodstream. And then the bloodstream carries that chemicals as well as other cannabinoids to the brain and other organs throughout the body. However, when an individual consumes marijuana in edible form, the body actually absorbs that THC chemical a lot more slowly. So in that case, the effects might take 30 minutes or upwards of an hour to actually be experienced by the patient. But with smoking, the effects are more immediate and generally peak within 20 to 30 minutes.
So what are some of the long-term effects of using marijuana?
So marijuana does affect brain development. And as we all know, your brain continues developing until around the age of 25. Typically, individuals who are using recreationally begin using marijuana as teenagers. So they might be around 15 to 17. And when you start using it at that point, especially heavily, the drug can have permanent effects on brain connectivity. This means it's going to impair thinking, memory, and learning functions, and then it's going to affect those connections and how the brain communicates with itself in these different areas. So this is a really hot topic that people are studying right now. A lot of researchers are investigating how long those effects on the brain last and whether the changes may be permanent.
So we don't know whether or not those changes are permanent at this point?
Some studies do suggest that certain changes are permanent. There is some research indicating that it can actually lower IQ by several points by the time visual becomes an adult. There's other research suggesting that it can permanently impact impulsivity and things like that. However, the permanent changes become a little bit less concerning once the brain is finished developing. And again, typically these occur from heavy use.
So when I work with patients who have marijuana use disorders, oftentimes I hear that they want to use marijuana over alcohol because you can drive while you're using marijuana, whereas with alcohol, you're not supposed to drive intoxicated. So can you clarify, can you drive while using marijuana?
That's a really great question, and it's something that my research participants ask all the time, and they almost always claim that they can drive better when they have consumed or smoked marijuana. This is absolutely not the case. So there are many studies indicating that marijuana does significantly impair motor coordination, reaction time, judgment, and decision makings. And then there are several studies that have found a direct link between THC concentration in the blood and impaired driving ability. It's a very complicated thing to study, especially because of how variable THC is in marijuana and how participants or patients likely don't know how much THC is in the marijuana that they're using. As that increases, their driving ability can be greatly impaired. And then another interesting point with this is that when even low levels of marijuana are paired with low levels of alcohol, so maybe even a couple drinks, we see a synergistic effect on driving impairment. As you can imagine, an individual might think that they're consuming a safe amount to drive when actually consuming those drugs together, we're seeing a greater impact on their decision making and reaction time.
Wow, that's really interesting. Since we're talking to clinicians, I'm curious, especially as we're starting to see in the U.S. more and more states legalizing medical marijuana use. What makes someone eligible for a medical marijuana registration card?
So in those 31 states that I mentioned that do permit use of marijuana for medical purposes, every single state has a different set of rules and regulations on approved debilitating conditions that permit a patient to apply for a card and different things like that. So I can give you some examples. In Rhode Island, where I conduct research, we have several approved qualifying conditions which might make an individual eligible to apply for a card. So this might include cancer, glaucoma, HIV, AIDS, hepatitis C, or another chronic or debilitating pain disease or wasting syndrome, severe nausea, seizures, and there are a lot of conditions that are being added to this list all the time. And then to become a medical patient in Rhode Island, an individual must be a resident here and then must have been diagnosed with one of those disorders that I listed by a physician. And then they must provide medical records, and over time, it kind of varies, but about every 6 months, they must continue to provide medical records so that they can keep their card. So at that point, they're permitted to visit one of our 3 marijuana dispensaries, or there are also laws and regulations that permit them to grow a certain amount themselves. Now, I also looked this up in Texas because I know a lot of the physicians there are listening to this, and the laws are extremely different there. So in Texas, patients right now can only obtain CBD oil, and this is only if they've tried at least 2 other prescription medications. Now, CBD, or cannabidiol, is another cannabinoid in the cannabis plant. It's actually non-psychoactive, so it's a lot different than THC, and this is what's been implicated in a lot of anti-inflammatory effects and pain reduction. But in Texas, this is the only thing that's permitted to use medically, and it's under very strict situations at this time. And then if we continue to look at other states, we would see a lot of differences there as well. So you kind of have to examine which state you're looking at to see what the rules are there.
As of February 27, 2019, in Texas, low THC cannabis is permitted for medicinal use only, meaning the product must contain no more than 0.5% by weight of THC and no less than 10% by weight of CBD, according to the National Conference of State Legislators, which is a non-governmental organization supporting all state legislators in their respective endeavors. Looking at different states, we see that Washington, D.C., California, and New York allow patient registry or ID cards. While all 3 allow dispensaries, New York limits ingested doses to 10 milligrams of THC, and the product is not to be combusted. Therefore, it cannot be smoked. Finally, D.C. and New York specify conditions, while California does not, and neither California nor New York recognizes patients from other states. This stipulation is not yet specified for D.C.
So you mentioned that HIV is a condition that somebody would become eligible potentially for a medical marijuana registration card. Can you talk more about the effects of marijuana on HIV treatment?
Yes, absolutely. So the literature in this area is a bit inconclusive so far. It's also a popular area for research right now. But it appears that depending on the level of cannabis use, occasional cannabis use or marijuana use has been linked with increased ART adherence and relief of different HIV symptoms. However, heavy use of marijuana is still associated with low ART adherence and some negative psychological symptoms. So if an individual isn't using very heavily, it may actually help them adhere to their medication regimen. There are some other studies that suggest that using marijuana medicinally might actually facilitate rather than impede ART adherence for patients with nausea, because those patients may have trouble taking their ART medications due to nausea. And then finally, some research in 2014 by Rayborn and colleagues actually found that the activation of cannabinoid receptors in the brain by using marijuana for medical purposes may actually inhibit inflammation in the brain among individuals with HIV because it prevents the virus from attaching to cells. So more research is being conducted in that area, but marijuana's anti-inflammatory effects may be very important here.
Very interesting. So how would clinicians be able to tell if a person is abusing marijuana rather than using it for medicinal purposes?
So this is a complicated topic, actually, because overall, individuals who obtain a medical card tend to really be using it for medical purposes. Individuals who use recreationally, so they may not be able to go to dispensaries, but they're still using marijuana, they may be using that for medical purposes to treat a medical condition. Frequently, this might be chronic pain or something like that. So it's difficult to say the percentage of individuals who are really using medically versus recreationally because of this. So just because someone doesn't have a medical card doesn't mean they're not using it for medical purposes.
So I'm curious, how do you distinguish between someone that uses marijuana for medical purposes versus recreationally?
So typically, from my experience working with medical patients, they have tried a lot of different treatments for whatever their particular illness might be. And often marijuana is the last thing that they try, and it is oftentimes more effective than other things they've been using. For example, I've spoken to many medical patients who have been on opiates for a long time, and starting to use marijuana has allowed them to decrease and often even eliminate their use of opiates, just because the marijuana seems to be just as effective to manage their pain with less negative symptoms. So that's just one example. I think just really getting to know your patients and talking to them about what they've tried and, what they're experiencing, and really listening to them is probably the best way to handle that.
So you brought up the use for medical marijuana in potentially treating opioid use disorders, which is something, as an opioid use researcher myself, I hear all the time, is that marijuana potentially could be a cure for the opioid epidemic. What's your thoughts on this?
I don't know if I would consider it a cure. We need a lot more research in that area, but I definitely think that it may be an alternative substitute for a lot of patients. They seem to fare a lot better on marijuana than opiates. It seems to do a better job of decreasing pain and inflammation levels that they might be experiencing without some of those other negative side effects. And while you do still build a tolerance to marijuana and you can become dependent on marijuana, they just seem to handle it better than the opiates, and they seem to be able to use it over time a lot more easily.
So I hear all the time from patients that you really can't become dependent on marijuana, and that's why people like using marijuana so much. Is that a myth, or can you actually become dependent on marijuana?
So that absolutely is a myth. You can become dependent on marijuana. We would actually call this cannabis use disorder, and that is when an individual continues to use marijuana despite a lot of significant distress or impairment in their everyday life. So cannabis use disorder is typically characterized by this really strong desire to continue using marijuana, and then a lot of difficulties in controlling its use, continuing to use despite experiencing harmful or maladaptive consequences, and then giving that substance or drug a much higher priority than engaging in other activities, going to work, spending time with family, things like that. So what we typically see in this disorder are both psychological and cognitive problems, as well as social problems. So when an individual is using all the time like that and they really feel that they can't stop, they might experience frequent anxiety, nervousness, even bizarre or false beliefs may occur over time, impaired judgment or problem-solving ability, and then a lot of difficulty with work or family members and other activities.
This has been very informative. Thank you, Dr. Aston. This has been a Project iCare podcast with Dr. Kasey Claborn and special guest, Dr. Elizabeth Aston. If you liked our show and would like to learn more, check out our website at sites.utexas.edu/Health Innovation Lab, or find us on Facebook at UT Health Innovation Lab. Visit our website to find out more about Dr. Aston and other resources discussed in this podcast series. All the information will be linked in the description below. Stay tuned to hear Dr. Aston discuss more about her current research projects. Thanks for listening, and join us next time to discuss other interesting topics around substance use, mental health, and HIV. I'm curious to hear more about some of your ongoing research projects. Can you tell us a little bit about that?
Definitely. So right now I'm about to start a study in recreational marijuana users where we're going to administer marijuana in the laboratory. And we're really interested in looking at an individual's demand for marijuana. So that's their perception of how valuable marijuana is to them. So we actually asked them how much they would pay, how much marijuana they would consume at different levels of price, and we increased the price over about 20 different prices to see how much they would consume. And we'll do things like change the instructions or manipulate the scenario so we can see what kinds of things might alter their demand for marijuana. So things like cues in the environment, stress level, even pain can change an individual's demand for marijuana. So we're really excited to get that study started.